I'd like to talk wisdom teeth, Dr. Diez. Why are they called wisdom teeth anyway? But that's really a personal question I have. But rather than that, people are afraid of wisdom teeth. Tell us all about it. Why they're there, what they're there for, and why are they so difficult to handle?
Well, I'll be honest with you, I'm not sure why they're there. They're kind of like a spare tire, but the only problem is we rarely could use it. 80-90% of the population just do not have room for the wisdom teeth. The good news is we don't need them. Wisdom teeth, people can function fine without their wisdom teeth, and matter of fact, most people do. Like I said, 80-90% of people have either had them removed or the teeth have never erupted. The problem is with wisdom teeth. I have adult patients, 60, 70 years old, that still have their wisdom teeth, where if anybody's looked at their x-rays, they see the wisdom tooth sitting in the x-rays, sitting sideways, kind of locked underneath the gum or behind a tooth. And that's when they say an impacted wisdom tooth, that's what they mean. The tooth is kind of is locked in there, and there's no room for it to come up. So there are cases where nothing happens. The tooth just stays there the entire patient's life, and it's no big deal. But there's a certain percentage, and a high enough percentage, where that wisdom tooth can cause some very, very serious problems. We probably see at least two or three cases a month where a wisdom tooth that's kind of sitting sideways has started to damage or cut into the tooth in front of it, which is a good, healthy tooth, a tooth that we want to keep the rest of our lives, a tooth that we function with every day. And typically, if the wisdom tooth cuts into the good tooth in front of it in that position, you lose both teeth. You lose the tooth in front of it that the wisdom tooth cut into, and the wisdom tooth has to come out. But it's not over there. Then the tooth above, on the top, the good tooth, that one has nothing to chew against. That tooth starts to shift. You usually end up losing that one too. So it's the domino effect. The point I'm trying to make is, because the problems that occur with wisdom teeth can be so severe, it is very wise, if it's determined, and it usually can be determined when someone is in their teens, that there's not going to be enough room for the wisdom teeth to have them removed. In your teens, the wisdom teeth, the roots of the wisdom teeth typically are not fully developed. However, dentists can, like I said, determine if there's going to be room or not. Most of the time, there's not going to be enough room for the wisdom tooth. If the tooth is removed while a person is in their teens, before the tooth is fully developed, it's usually very predictable and relatively simple treatment, surgery. When you hear of these nightmares of people having wisdom teeth taken out and having all kinds of complications, it's usually a fully developed wisdom tooth, and most of the time it's on older people. When I say older people, I mean after the age of 30, 35, that's when we start getting very, very hesitant to have the wisdom teeth removed. The bone is very dense back there, right? The roots are fully developed, and it's much more difficult to remove the wisdom tooth. So, in our practice, we start evaluating for the wisdom tooth at a very early age. Perfect example are my two sons. Both of them had their wisdom teeth removed when they were 16. The surgeon that did it, again, very simple surgery. It took about 15 to 20 minutes to remove all 4 wisdom teeth, but it's because the wisdom teeth weren't fully developed yet. And very predictable surgery at that age. So we typically recommend to have the wisdom teeth removed in your teens if we determine there's not enough room. Now, I do have some patients where there's plenty of room for the wisdom teeth, and by all means, then it's a normal tooth. It comes up, it's in a good position, and it's functional. But
those people really must be very, very wise people who don't have to have it removed.
No, I noticed them. They're much smarter than the average person. So, my wisdom teeth removed doctor, so I guess I'm not very smart. But again, it's very, very rare that a person can maintain their wisdom teeth. Usually when they come up, they're not in a good position helmet. And the population should know they're not necessary to function. We function perfectly fine without our wisdom teeth.
So they're kind of like appendix, huh?
Yeah. You know what I related to what is it? The fifth on a dog's paw, that fifth appendage that's getting up way high on the dog's arm, and some dogs don't have it.
Right.
Maybe in the next 2,000 years, if we're still around, the wisdom teeth will gradually go away. Some people are born without them. Some people don't have them, and they're the real lucky ones. But you're right. It's probably, that's a good analogy. It's like an appendix. It's not necessary.
All right. Well, thanks for shedding some light on the whole situation.